so now we're going to talk about mesotherapy of the chin as well as the face. Mesotherapy of the chin and the face. And again, as I mentioned earlier, this is definitely my favorite area because it's so simple to do and it works very, very well. It's very, very effective and it's very profitable. So everybody walks out happy. Patient walks out because they're getting good results. The nurse is happy right in your office because she's not spending all day with you in the room. You're happy obviously because it's profitable as well. Profitable as well as being effective. All right, so here's a really good example before and after. This is somebody that has a significant amount of fat right underneath their chin. Make sure you do a good physical exam. It's not for loose skin, okay? This is really just for fat underneath the chin. And this person is definitely a good example. Okay, here's another good example. Okay, and as you can see here, perhaps the most dramatic and popular indication for mesotherapy is mesotherapy right underneath the chin. Okay, the way this works is again, you'll get, a lot of times you'll have dramatic results after one visit, okay, but you can use up to 3 or 4 visits. They're 2 weeks apart. All right, so you'll see the patient, have them come back in 2 weeks. If you need to do a second visit, go ahead and do the second visit, and then see them again 2 weeks later. This is not indicated for loose skin. It's very important that you know that because some people routinely, right, they'll do that for loose skin, but it's not. It's really just for fat underneath fat underneath the chin. Anybody can tell me the dosage? Anybody remember from 10 minutes ago?
0.4 cc.
Okay, that's one idea, 0.4. You wouldn't be wrong. 0.8. 0.8 to 0.9. Okay, the key thing here with this is you don't want to over-inject. Sometimes we all have a tendency sometimes to want to inject more than you really need. Okay, and the problem with that is that's not the correct way to do it, and also you'll get side effects. You'll definitely get some edema and so forth. Make sure your patient is sitting upright. Okay, you want them to be sitting in a chair, sitting upright because of gravity. Right, if they're lying back, it's going to be a little bit more difficult to inject them. Yes, doctor, you had a question?
How many injections?
Okay, how many injections altogether? Well, I have a couple slides here that's going to show you one injection right in the middle. But the better way to do it is 3 injections. Okay, so what you're going to do is you're going to inject one in the center, okay, one on this side over here, and one on this side here. And that medicine is going to spread all over that area.
When you go to the side, do you use any landmark or just...
It's really, you're asking about a landmark. It's not as precise like in Botox where you're getting the needle. This medicine spreads. Okay, so it's really your landmark is where the fat is.
Okay.
All right, so you see a substantial amount of fat underneath the chin, so you inject one here, one over on the other side, and one on the other side over there as well.
So you can divide 0.8 into...
So that's correct. You divide the injections. Okay, so let's say your total dosage there, we said between 0.8 and 0.9. Right, so you go 0.3 here, 0.3 here, and 0.3 on the other side. Okay, and what size syringe were you using? Using really any type of syringe, but since you're injecting so little, you're going to use a 1 cc tuberculin syringe. What size needle are we using?
30.
Right, 30 gauge, 1/2 inch needle. That's correct. You could go, yeah, the key thing with that to understand is that the medicine is not viscous at all. It's not like we're injecting fillers, so you could go actually, there's a 33 gauge needle, but a 30 gauge is more than sufficient. So, sure.
After you do like that guy,
Hey, you know what, let me give you the microphone while you're asking the question so I could have that.
after you do the injection, like on that guy fat underneath the chin, it's going to leave loose skin, right? How do you treat that?
Good question. All right, so she's asking about the loose skin. Okay, well, that's not, first of all, that's not an automatic thing. It's not, you can't assume that you're going to do that and you're automatically going to get loose skin. Okay, if that were to happen, though, there's other treatments. There's different types of skin tightening procedures. There's laser treatments that work very, very well. That I use lasers in my practice. I use skin tightening lasers. But to be quite frank with you, you really don't typically get loose skin, you know, when you do that. It would be kind of unusual to get it. But if you do get loose skin, you can use a skin tightening procedure. The key thing also is just make sure you're not doing it on somebody that already has loose skin, because it will make it a little bit worse.
Right. The older the people, the worse it is.
Right, that's true. Okay, what else? So we talked about, well, here are a couple examples, a couple pictures you could see before and after. All right, and you also see the dosage here in this picture, and you also see the different injection zones. So in this picture, they're actually showing where you're injecting just one right in the center, which you can do. I think the better method is where you're dividing it up amongst the 3 injection spots. Here's another example of a before and after of a chin. Okay, here's another before and after example. All right, here it's showing you 2 different injection spots to locate. Okay, now we haven't talked about this yet, but let's go over this a little bit. This is now mesotherapy of the face, mesotherapy to inject jowls, all right, to treat jowls. And mesotherapy is actually very effective on treating patients that have pronounced jowls, and it's not a difficult procedure at all. The technique is basically the same, all right. You're using the traditional approach. Right, you're not using the page or you're not using anything else. It's a traditional technique, all right? And again, one of the key things to remember is don't over-inject. You're injecting a very, very small amount of medicine into the area. All right, so you can see from this picture, this would be the focus of where you want to place your needle. The total dosage there is 0.2 cc's. It's a very, very small amount. Make sure you don't over-inject. Okay, 0.2 cc's total volume. And remember earlier we talked about, they call this a Perlin mesotherapy where you're injecting the peaks first. Okay, so make sure you can see from this image, that's the peak. That's where you want to inject that. Okay, the same thing on the other side. All right, and it's 0.2 cc's. You're going to have them come back 2 weeks later. You may want to inject them again, and you could inject them up to 3 times. All right, but you're going to be surprised. A lot of times with these small locations, like underneath the eye, underneath the chin, and the jowls, you may only need 1 visit, and that you could get really good results just from the 1 visit. Okay, how about this patient? This would probably be a good result, right? What do you guys think? She's shaking her head yes. This would be a good candidate? What do you think? No. This is a very, it's an elderly patient with loose skin. There's no fat there at all. There's really nothing to treat. That was a trick question because we had this one on the left. So I kind of did that on purpose.